The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
Okay, thank you, and thank you for joining. This is certainly an interesting topic, and I get questions about it all the time, and I think a webinar is a really great way to talk about all of this because you're in the comfort of your home. I don't know who you are. You can probably watch this again if you want, but these are great devices. There's a lot of questions about them, a lot of good stuff, a lot of bad stuff on the internet about them. So let's make it official and go through it. So first, let's talk about what an erection is, so that you understand why these devices work. And erection is, so you have three muscles in your penis, and these images show a cross section of your anatomy. An erection is when the two erection muscles fill with blood. So the process is there's a nerve signal that tells these muscles increase the blood flow, open up the arteries, fill those muscles up, and as those muscles fill with blood, they become hard and they push on the veins. So veins take the blood back to the heart, arteries bring the blood away, and when the veins are pushed, then the arteries fill up and you have an erection. And then when the process is over, the erection goes down, the blood flow goes back to normal. So that is the process of an erection. It involves nerves, arteries, and veins. So we're going to talk about vacuum devices. I've got two I'm going to show you tonight. Both are available on this website. Both I have in my office. These are FDA approved since the 1980s. They have lots of different names: vacuum device, vacuum therapy, VED, penis pump. And basically what it is this tube goes over your penis. You create a seal, and then you pump it up, whether it's a hand pump or a battery operated pump, and it pulls the blood into your penis. So it helps. So guys have different reasons for having issues with erections, but this gets that blood flow in. So you can watch and you can feel the erection happen, the penis expands, the blood flow comes in. And then these rubber bands, these weird kind of 3-eye rings you see on the bottom of the screen, go at the base of your penis, and they keep the blood from draining out. So those function as if they're collapsing the veins for you. And that's how this device works to give you an erection. Studies show that men are really happy with this. Over 90% of men that use it find success with it. And we're going to talk about this a little later because it takes a learning curve. You're not going to get it right the first time. Don't get mad. Don't be a perfectionist. You're not going to get it right the first time. I didn't get it right the first time using my office models. Okay, so this takes time. But in guys who use it, over 80% of them are happy with it, like they continue using it. That's a really big number. 80% is huge. And with partners, the satisfaction rate is over 70%. Like the erection is firm enough that the partner is happy with it. So those are really big numbers. If you're going from 0 to 80%, that's a huge change. So this is really a great tool for you. So this is a little bit of what I was talking about. Is there are different parts to this, and just like any sort of device, you want it to fit well. Okay, so there are, and I'll put one of these together later, but there are rings that come with the device, and this looks really small, like it literally is very small, but it's stretchy. Okay, so it stretches. This is the constriction band. This is the band that goes at the base of the penis that keeps the blood flow in for the erection. Okay, so there's different sizes, and these kits have different tools to help you size yourself. Okay, you're not going to get a good fit if it's too tight. You're not going to get a good fit if it's too loose. So you have different options for that. And then you decide if you want a manual pump, a pump that you squeeze. This is an example of a manual. Oh, going the wrong way. You would squeeze this. Okay, that's a manual pump. And then I also have an attachment that's a battery pump. And this you would just push the button and it would start pumping automatically. There's kind of ups and downs to both of them. The automatic one's more expensive, but it just depends. And then there's different adapters that go on the end of the tube, depending on what size you need. And you also need lubricant. You cannot do this without lube. So it's really important that you have all the parts, you have the right sizes, and your kits are going to come with a lot, but don't give up. That's why it takes several times to get this right, okay? There's lots of different components to this. All right, here we go. Here's all the components. So I will put this together as we talk about it. This is the picture on the screen. So you have the top of the pump, all right? This is the pump head. You have the tube. You have these, what we call, we have the transfer, oh my gosh, I'm sorry. We have the transfer sleeves, all right? This is what you put your penis in and then into the tube. You always have a bottle of lube somewhere. I'm a urologist. I always have, there's lube everywhere. So always lube in my office. And then you have this loading cone. This is really important for getting that band on. I don't know if you could tell how hard I had to pull to get this, because you want this to have a nice seal to keep the erection. What this does, what this cone does, is it lets you put the band on to put it on the device to then be able to slide it onto the base of your penis. And then that picture, number 6, is the different sizes. It comes in the manuals. That helps you size what kind of tension ring you need. You'll get all these, you pick your size, and then you have your variety of rings. And this is what's in your kit. It comes in this really nice travel case too. All right, here we go. Here's the VED learning curve. There is a learning curve, okay? And please don't get frustrated. The guys that quit are the guys that tried it once and it didn't work, all right? It's also, you got to have a supportive partner, okay? So I'm just going to assume most of you are married or in a relationship. You have to tell him or her, all right? I'm just going to say her because most of them there's a her. Hey, I need a few minutes, okay? Like, you guys are ready. This isn't spontaneous. It takes a little bit of planning. You need a couple minutes to do this. It shouldn't be like, hold on, give me an hour, right? But you got to what I tell my guys when they buy one is practice by yourself several times. You know, don't have your partner around, you know, no one in the room, no one waiting for you. Just get used to it on your own, because it takes a lot to get it right. And like, I can't be at your house doing it for you, okay? Even if I was there, it might be hard for me because this isn't something I can do on my body. But it takes a while. You got to get the right band. You got to figure it out, put it together, and you'll get there, but don't give up, okay? Your goal should be that this takes you 1 to 3 minutes. That's the second to last point on this slide. You want to be able to create your erection that you want to use within 1 to 3 minutes. And if you're not there, keep practicing, okay? And the more you do it, the better you're going to get at it. So don't give up. Those are my unhappy guys, the ones that quit too soon. This is going to be the video that demonstrates the device. This one is going to demonstrate the Rapport Classic one, okay? And I'll show you both of them also later.
Before you start, familiarize yourself with the contents provided in your Rapport Classic Vacuum Therapy device system. You will find the constriction ring sizing guide at the back of your instruction for use booklet. To use your Rapport Classic device, you will first need to determine the correct constriction ring size. You have received 5 constriction rings with your Rapport Classic device. Select a slot which fits firmly around the base of your flaccid, non-erect penis. Try the largest size first. Each slot has a ring size marked above it, which corresponds to the ring you require. The constriction ring is placed at the base of your penis, next to your body, and choosing the correct ring size is important to maintain the erection for the necessary period. Once you have selected the right ring size, you're ready to begin. There are 2 transfer sleeves provided with your Rapport Classic system. Depending on the size of your penis, you should choose which of the 2 is likely to be the most suitable. Remember, your erect penis will need to be withdrawn through the transfer sleeve. One of the transfer sleeves included with your Rapport Classic system is already attached to the penile tube. If this is the correct size transfer sleeve for you, you can leave it in place. If not, remove it and fit the remaining transfer sleeve. Fit the loading cone onto the transfer sleeve and apply a little lubricating jelly, included with your system, on top of the cone. Holding the constriction ring by the outer handles, simply stretch and pull the ring down the loading cone until it slips onto the transfer sleeve. Make sure the constriction ring is located on the flat groove at the center of the transfer sleeve. The constriction ring is now mounted and ready for use. Before continuing, make sure you use the lubricating jelly to lubricate the end of the transfer sleeve. Also, lightly lubricate the penis to prevent it from sticking to the inside of the penile tube during insertion, or while using the pump. The pump head has 2 small pegs on each side above the orange ring. These should be positioned into the 2 grooves on top of the penile tube. The two parts are then locked together with a twist so that the two pegs slot down and locate at the lower end of the groove. If these two parts are locked together correctly, it will ensure the unit is sealed tight enough to create a vacuum inside the penile tube. To ensure a vacuum will be created, insert only your penis into the penile tube and apply slight pressure to the seal with the transfer sleeve against your body at the base of the penis. To ensure that a vacuum is created, it may be necessary to groom the hair at the base of the penis. Make sure the constriction ring on the transfer sleeve is in the correct position with the handles to the top and bottom. Continue pumping slowly to create the erection. If you feel any pain, stop pumping and press the release button to eliminate the vacuum. You can try again when you're ready. Pumping slowly is most beneficial. When the desired erection has been achieved, continue to hold the tube tightly against your body. Ease the constriction ring off the transfer sleeve and onto the base of your penis. Press the release button to lower the vacuum pressure and remove the penile tube. With the constriction ring in place, sexual intercourse can be accomplished. If a condom is to be worn, it should be put on as a last step. Please ensure that the lubricating jelly used with the system is compatible with your condom type. To remove the constriction ring after intercourse, simply grasp the outer handles to stretch the central ring. As the blood is released from the penis, it will decrease in size and the ring may be easily removed. Do not wear the constriction ring for more than 30 minutes at a time and allow a minimum of 60 minutes between uses. Please consult your instruction book.
Okay, that 30 minutes, I usually tell guys 20, and I think you're going to figure it out yourself because when you put this on, you could, if you have a rubber band in front of you, put a rubber band around your finger, make it kind of tight, and then you tell me how long it takes for that to hurt, okay, for it to turn kind of purple. So 30 minutes, definitely max. I try to aim for more 20 because this is tight. It's got to be a good fit to keep the erection, but you do want to watch that time. But I think your body's going to tell you, hey, it's been 30 minutes, please take this off of me, okay? So that part is important. But it's a really good demonstration video. So most of that has been using the vacuum device to have an erection for intercourse. I also try to get every post-prostatectomy patient to buy one. I want them to buy it. I want them to use it as soon as their surgeon has released them from surgery. And they'll usually start as soon as 4 weeks out, maybe even sooner, because it's really important for penile reconditioning or penile rehab. And the biggest difference between using it for these two is there's no ring. There's no ring for this one because this one is, it's like rehab for anything else you've had surgery on, right? It's rehab for a knee replacement. It's rehab for a new joint somewhere. You have to start slow and do repetitive maneuvers to get your strength back. So I want to go through the penile reconditioning protocol with you. Okay, so penile reconditioning in general is what we say, this is kind of broad. This isn't related to post-prostate cancer treatment, but it's the same concept. So it's for men who've been inactive and don't have the nighttime erections anymore. Normally, your body goes through several cycles as you're asleep. And so one of the questions a urologist should be asking you is, do you still have those nighttime erections? Do you still have those morning erections? And if you do, that's a good clue to us that everything is still working, right? The nerves, arteries, and veins are working. So now we optimize. And if that's gone, well, then we have to think about other things for you. And this vacuum device is one of the good things to do. But what you're doing it in a reconditioning, in a rehab setting, is you're putting it on, you're pumping your penis up, you're pulling that blood in, reminding it how it works, okay? And you're holding it. You're holding it for 1 minute, you're holding it for 3 minutes, and you're repeating this process. So here this line says do it 3 to 5 days a week for about 20 to 30 minutes each time without the ring. And what I tell my guys, and you might get different advice depending on who you talk to, is put it on, pump it up, and hold it for 3 minutes and release it. And I want you to do that at least 3 times. And I actually ask you to do it every day. So I don't do the 3 to 5 days. I do kind of quicker, shorter intervals. I ask you to do it daily, but everyone has their own plan. So it's all very similar. And this reminds those muscles to get back in shape, right? Like just like if you've been in a splint or in a cast, those muscles are weak. You've got muscles in your penis. I don't think a lot of men really understand that. And so this is getting the blood flow back in, getting them to work again. And I've got a lot of really great results for this. And this is a wonderful tool for reconditioning and for rehab. I think we're going to talk about rehab next, if I remember the slides. Okay, well, we're still talking about reconditioning. So this is it. Again, pictures of it. Pump it up, hold it, release it. Pump it up, hold it, release it. It's just like repetition you would do at the gym. You're just doing it with this muscle. And please don't do this at the gym. I think you'll get kicked out. And don't use my name. I did not tell you to do this at the gym, okay? All right, so any man with any sort of form of erectile dysfunction can use a vacuum device. This is good. There's high satisfaction rates, okay? You do it for reconditioning. You do it after prostate cancer treatment. You do it if it's just been a while and you just need to try to get those muscles back in shape, okay? Some guys, and we'll talk about this in the Q&A, some guys use different modalities. Some will be on daily Cialis. They'll be on as needed Cialis or Viagra, and they'll still use this, and that's okay. You can find out how to mix and match those things. Just get some guidance from a urologist, okay? And this is the last point on this slide. It is the only data proven thing to do after prostate cancer treatment to get some penile length back. A lot of guys, I don't remember the most recent number for this, think they perceive that they have lost penile length after surgery for prostate cancer. And I think a lot of that is related to the blood supply that has to get removed when the surgeon takes the prostate out. This is the only thing you can do that will get you length back. And so that's really important to a lot of guys. And I really encourage my prostate cancer survivors to buy vacuum devices. All right, let's talk about side effects. So most common, and I don't think this is really a side effect, just kind of the way the device works. If you have this thing on the base of your penis and you ejaculate, it's not going to come out, right? It's not going to come out because this is tight and it's holding it in. But there's 3 processes here, and I have to tell this, I tell this to my patients and their wives all the time. There's an erection, there's an orgasm, and there's an ejaculation, and they're different, okay? So the vacuum is going to help with the erection. You're going to get to orgasm. That's the sensation. That's what everyone's looking for. That's what you want, right? And orgasm can happen without an erection. And some of you listening have probably figured that out. So you can't have penetration without an erection, but you can have orgasm. And then ejaculation is the third part. If you've had your prostate removed for prostate cancer, if you've had different prostate surgeries, if you've had radiation, sometimes you don't have ejaculation anymore. But you should still have the orgasm, the sensation. You just might not have the fluid release. And what I try to explain is the fluid release is biological, right? That's how semen, that's how sperm gets to make babies. And so at some point you make less, there's less volume. You might not have any anymore if you've been on certain medicines or had surgeries. And if you're not aiming for fertility, it's okay. Then let's just focus on erection and orgasm, okay? So that's my tangent about that. And some guys report pain, some report bruising, some report discomfort. It's similar, it's a suction device, right? So a hickey is from suction, right? And it gives you a bruise. So it's kind of like that. That's why there's a learning curve. You have to play with it. You have to get the right fit, and you always have to use lube, okay? And you can't be too aggressive, and you can't leave the band on too long, all right? The best thing is just to do it and do it the right way. Okay, go to menmd.com and watch videos. I know that one of these devices, the Soma from Augusta Medical, you can call them anytime. They're a mom and pop shop. I've met them. I've been to their store. They're so awesome. You can just call them and say, I'm having trouble, and they'll troubleshoot it on the phone with you. They'll set up a video consultation. I'm sure Owen Mumford does the same thing. I just haven't had to ask them for that. There's all these people out here who can help you, okay? And then it's not that if you're on blood thinners, it's not that you can't have a vacuum. You just have to be careful, because you can imagine the vacuum's pulling blood in. If you're on a blood thinner and there's too much suction, it's a little too rough, you can get a gnarly bruise, and that's a part of your body you don't want to bruise on. So it's not that you can't do it. Just go slow and be extra careful, okay? And if you get a bruise, if something bleeds under your skin, you're going to have to take, time off for a little while and let that heal, and maybe think about if a different treatment option is better for you.
This is where we'd like to thank Owen Mumford for helping us make this webinar possible tonight. They're the creators of the Rapport classic vacuum erection device that Dr. Stieglitz will be holding up on the screen shortly. Alrighty, and here's a slide that I'd like to share as well. This is just a note from MenMD. So there's definitely other people out there that carry VEDs. However, ours are all FDA cleared and medical grade VEDs. We offer free shipping on all VED orders. You also get exclusive access to that patient support service that Dr. Stieglitz just mentioned. So in addition to the manufacturers, MenMD has their own call center and their own patient support team where you can call in and get the same sort of service and troubleshooting. We work continuously to develop and share these educational resources with you, such as this webinar. So thank you for joining and tuning in. And to carry along with our presentation, I believe that is going to bring us to the demonstration portion of the event. So I'm gonna take down the screen, and Dr. Stieglitz, it's all yours.
I got really big on my screen because the slides are gone. I also want to say, he just commented on it. Be careful where you buy these from, because I think we'll get more into the Q&A about things that can go wrong, such as your whole scrotum gets sucked up into it. So you want a device, and this is all urologists are trained to tell you this, that has a vacuum limiter. So you need a medical grade one. You can go to a sex shop, you can go to Amazon, you can buy a cheap one, okay? But they can cause harm if they create too much suction. So you want to buy a good one, all right? I send all my patients directly to MenMD because I know they only carry medical grade ones. It's an easy website to remember. I know the urologist who started it, right? It's just like a really great resource. I don't get anything from that, from sending people to them. But guys go online, you know, they go to all these different websites to talk about sexual health. MenMD's a good one. There's good people behind it. Sometimes they buy directly from the manufacturers. I think it's the same price. I know it's the same price. It doesn't really matter where you get it from. You'll get help no matter where you go, where you buy it from, but please don't buy a bad one, okay? Please don't tell me your whole scrotum got sucked in because I can't help you. You're gonna go to the emergency room and they're gonna make fun of you. Not really, but let's put these together. So let's start with the Owen Mumford one. Again, you have the tube. I'll try. This is the, I don't have a desk in my video. Yes, I do. You can kind of see it. Okay. This is how you load the constriction device. So you have this cone that you set on it, okay? And then you would stretch it out. I'm not going to use lube because it's going to make me really messy, okay? And actually I forgot to put this on first. Here I am doing it backwards. So first you there's two of these. Both of these models have two different ones. It just really depends on the girth with an erection that you need, okay? Bigger or medium. I'm not going to call it small. And then when you're ready to put the constriction ring on, you have this triangle shaped cone, you lubricate it, you stretch your constriction band out, and then you use that. It might pop, and I'm not being very graceful. Of course, you'd be more graceful. And then I have it loaded. I didn't have it seated all the way. Then I have it loaded, all right? And again, how they had it in the video, you want it up and down, and I can't demonstrate this for you because it's easier at the end of the day when you have the erection to pull it off of your penis when it's up and down, and I just popped it off anyway. But once you have that loaded, this is super easy to figure out. You just you line it up with the little slots, and you turn it, and then that's it. So you would have this against your penis. Really important here to have a good seal here, to make sure only your penis is in here. Use lube. Those are the guys that accidentally suction the scrotum up, is if you don't have a good seal here. And then all you would do is squeeze this, and I don't know if you can hear me well enough, but you can hear the air trying to pull this in. You can hear the pumping. You can feel the suction against the palm of my hand, and you would just watch until you're ready for the erection. And then when you're ready, you slide that ring on your penis, you have it. Don't leave it on for more than 30 minutes, please. And if you're doing it for rehab, if you're doing it after a prostatectomy, what I really like my guys to do is day one, pump it up 3 times, and on the 3rd time, take a Sharpie and mark how long it gets, mark that length. And then with time, as you do it over and over again, I've got guys who come in and they'll say, like, it's an inch longer than where I started, and I can see that. And that's really, really good feedback for you. And then I have guys that name them, and I have a lot of fun stories with my patients. It's a fun healthcare thing to be in because it's a happy thing. So that's the Owen Mumford, the Rapport one. That handle looks different than the Soma one. The Soma is from Augusta Medical in Augusta, Georgia. So again, we have 2 different seals for the bottom of it that go against your pubic bone. This is what the penis goes through. So depending on how much girth you need, you put one at the base And then this one again has a cone. I'm not going to go through that again, but it has a cone and it has a constriction band that you would put on the cone and then slide it on here, okay? These bands look different. I don't really know. I can't tell you one's better than the other, but these have a different sort of handle. And I think these are easier to stretch and they're thicker versus the other one. And again, I don't know personally, professionally, if one is better than the other. They're just a little bit different. And then this one has, this is the manual pump. And you would just slide it on and pump, just like the other one. And this one, I also have the automatic pump for, and I think the batteries are working. It gets played with a lot in my office. There it goes. I pushed the wrong button. And you can hear it creating a big suction. If you're using a vacuum after a prostatectomy for penis rehab or for penile reconditioning, don't buy the battery one, okay? It's better for the manual one because then you can control it. You pump it up as much as you can hold it for a few minutes, let it go. So buy the manual one for that. And if you're interested in using it for erections, then you can consider doing this one. This one I think is $100 more, the battery operated one, so it's more expensive. It doesn't really matter, but for the rehab, the reconditioning, always get the hand operated one. That is recommended. I think that's all I have to demonstrate with those.
That leads us up to our Q&A session. So to start us off, we have one question here that I thought it stood out to me because it's talking about PDE5s, which is Viagra and Cialis. And so this person, they asked, if I can barely maintain an erection without using a pill, will I need to use that same pill to make the VED work properly?
No. And I have a lot of guys that I put on daily Cialis. So this is a personal practice of mine, but a lot of urologists do this. I like the 5 milligram daily Cialis because it optimizes your blood flow. It optimizes your penile blood flow. There's a study out there that it reduces rates of vascular dementia, lowers blood pressure a few points. It's just a nice blood flow pill for your whole body. And I have a lot of guys who are on the daily Cialis, and it'll bring back their morning erections, but not enough to work with, right? Just like some fullness, maybe a 3 out of 10. And it'll help them get started for an intentional erection, but it won't get as hard as they want or last as long. But it's a nice baseline. So I'll have them do the daily Cialis and do the vacuum. All of my prostate cancer patients do daily Cialis and vacuum. That's our rehab protocol here in pelvic physical therapy. You can take a Viagra, you can take a Cialis, and you can use the vacuum. That's fine. And you have to play with that on your own. You're not going to hurt yourself, okay? You have to decide, does it work better when you take a Viagra with it? Does it work better with a Cialis with it? Does it not make a difference? Then don't take them. But I definitely tell you that you can try that.
Alrighty. Moving right along, our next question here, this person is asking, does a VED require sexual arousal to work?
No, because you're going to give, the pump is going to give yourself, it's going to give you an erection. That pumping mechanism is going to pull the blood in. So you're going to bypass the arousal part of it. That's usually when we start talking about treatment, is guys who desire an erection, but they can't get one, or it doesn't last long enough, or isn't as firm as they want it to be. Then you need something else, because that process, I summarized it in 20 seconds, an erection process, but it's really complicated. And if something is wrong, nerve, artery, vein, 2 of them, 3 of them, all of them, then even if you feel like you want an erection, nothing you do is going to give you one, right? You need help now. And so that's where the medicines and the pumps come in.
Alrighty. Next question here. How long can I expect the erection to last with a VED? And I think we can rephrase that to how long should the erection last when using the constriction?
Please take your ring off after 30 minutes, but I think your penis is going to tell you to do it sooner. It's going to hurt, okay? So you can expect it to last as long as you leave that ring on, because if that ring is the good fit, if it's the good seal, then it's going to keep the blood in, and that erection ends when you loosen that ring.
Next question here. Will a VED interfere with the ability to reach climax?
Well, again, that's why we have to separate them. There's orgasm, which is sensation, which is what I consider climax, because that's what the goal is. Ejaculation is the fluid release after orgasm. And yes, with this band on, it could be hard for the ejaculation to make it through the urethra because it's kind of being pinched shut. It might fall out later. It might fall into the bladder, okay? But orgasm, should still be accomplished. The vacuum won't do anything with that. The vacuum only gives you an erection.
Perfect. Alrighty, next question here. This person wants to know if a VED is comparable to a penile implant. And so they're asking for pros and cons of both. I don't really know if they're directly comparable, but maybe we could highlight some differences.
Yeah, so it's a loaded question. So they're different. They're both going to give you an erection at the end of the day. Okay, yep. The penile implant is going to give you an erection every time. It is a surgery. It's an internal pump, but it works totally differently. I have them in my other office. I don't have any here to show you. The penile implant, I'd say, is going to be more spontaneous. If you have the surgery, you have the implant inside of you, you want an erection, you just find the pump in your scrotum, you squeeze it seven times, it takes you 20 seconds, you have an erection. Okay, you could be fooling around and, oh, let's go, pump it up. The vacuum device is not surgery. Okay, so it's not surgery. You don't have anything inside of you, and it takes just a little more planning, right? So you go, oh, we're ready, we're going to do this. Let me go get my vacuum. I'll be right back. But it kind of removes that spontaneity a little bit. So when I talk to my patients, I try to figure out what their biggest goal is. I got a lot of guys who've had 20 surgeries and they don't want any more. They're going to do anything they can to avoid a surgery. Well, then let's try the pills, the shots, the vacuum. And then I have guys who have tried all of them. They're frustrated with the vacuum. They want to be spontaneous. Maybe they're dating, right? Maybe that makes a big difference too. Do you have a partner who's supportive, or are you trying to be as normal as you can? Well, then you might be thinking about surgery. But I don't, they're comparable in that they both give you an erection, but the way they do it is very different. And you don't have to try the vacuum before you have surgery. But once you have surgery, you can't take it out and say, never mind, I want my vacuum back. Surgery is always the final answer. Hopefully that explains it a bit.
I think that did a great job of answering that question. Thank you for tackling that. Alrighty, here we go. Next question here. Are VEDs good for someone with diabetes? I think they meant, will it work for someone with diabetes?
Yeah, it still should. It still should. The only people it doesn't work in are the people that give up or they're not doing it right. Okay. I mean, the data says 80% of people keep doing it. So there's a 20% that just don't like it, don't want to do it. They don't like it's not spontaneous, takes a little work. You know, there's a 20%, not failure rate, but maybe non-compliant rate. Diabetics, what we know about diabetics is the pills fail faster in diabetics. So again, I still try to start you on pills, but I will say, you know, good chance this doesn't work at all, but no data at all that the vacuum won't work. Okay, so the vacuum, the surgery, the shots, you still have a really good chance at all of those.
Let's see, moving right along. Can you cause damage by using a VED?
I wouldn't say permanent damage. You can certainly hurt yourself. You can get yourself a bruise. You can, you know, maybe even rough up the skin if you don't have enough lube and there's a big suction seal on that. And you can scare yourself. I know I keep talking about it, but I had a guy who told me his whole scrotum got sucked up into it and he wouldn't touch a vacuum again. He was terrified. And we have this model in my office that we suctioned the whole scrotum up into it. And it was kind of funny looking, but I was like, oh, so that's how that happens. So are you going to do any permanent damage? No. Are you going to fracture your penis if that's what you're worried about? I can't imagine if you have a medical grade vacuum device that you would fracture your penis by inflating it with a vacuum pump. I don't know how that would happen. No one's ever told me that. I've never heard that. I just heard bruising, soreness, keeping the ring on too long, those sorts of things, mild things that aren't permanent.
Next question here. Can a VED increase penis size and performance long term?
Long term?
Yeah.
After prostatectomy, after having your prostate out, a VED, if you do that rehab program, is the only thing that will get length back. I don't know data outside of prostatectomies if it'll get you length back, because I just don't think we've studied it. But what I do with my guys, you know, inflate it, pull the erection in, pull the blood in, put a Sharpie on it, and then again, do your own sort of rehab and see. And if you haven't had a prostatectomy, I wouldn't go into it thinking you're going to get a lot of length, okay? If you're not happy with your anatomy in general, I don't think a vacuum device is your saving grace. I don't think it's going to double your penis size. But after a prostatectomy, it will, because there has been some shortening after that surgery. We don't have anything. There's no surgery. You got to be real careful. This is Googled a lot. People go to Mexico to get implants put in. This is not something we know how to do. Okay, I have been at conferences where they've shown PowerPoints of penises that are black because they're dying and about to fall off because they've had implants in to try to get bigger. So please be careful with this, okay? Don't go down that rabbit hole. One day, if there's something that will really enlarge a penis, a urologist will do it, okay? But be very careful looking into that stuff and pursuing any surgeries or treatments for that.
Alrighty. Some good words of advice there. Moving along to some other questions about using VEDs with other modalities. So I think this is a good follow-up to our question before. Can you use a VED with an implant in place?
Not with a penile implant. You got. I don't like it with a penile implant. That wouldn't make sense.
Alrighty.
Was that way? Well, you can use it with trimix. You can use it with injections.
Yep, that was the next question there. So.
Okay. Yeah. And then I have maybe a handful of guys that do that. I more often see Viagra and Cialis, Levitra. I see the pills with the vacuum more than I do the trimix. Most of the time, you don't need anything extra when you're doing the injections, but you can. And again, if you're doing the injections, you have to watch out for priapism. That would be an erection lasting more than 4 hours. And the vacuum can't really do that, but the vacuum might increase your chances of that by bringing more blood in. I don't have a statistic for that, but that's what you have to watch out for. So I'd say if you're happy with your trimix, right? If you do a 10-unit injection of your trimix and you're happy with it, don't play with the vacuum device. If you want to try it, then do a lower amount of your trimix, cut it in half, and then put the vacuum on top, do the trimix first, and then see if that's something you like, if you're trying to save money on trimix or something. But be very careful with that. I would worry about priapism. But it's not a strict contraindication. You can try it.
Perfect. Alrighty. Next question here. Can you use a VED if you're on Eliquis or AFib?
Yeah, you just got to be careful about the bruising. So it's a warning that you are at increased risk of causing a hematoma, a bleed. Nothing that, again, you should need a hospital for or a surgery for, but you might be pretty annoyed at yourself. So you just have to be gentle, use extra lube, go slow, be gentle with it. That's the only trouble with that, is if you get a nasty bruise on your penis.
Certainly. Next questions here are going to be around the setup and technique. So this person is asking how to prevent going limp immediately after removing the pump and ring.
Well, you probably will. If that's what you're using it for, the ring keeps you erect. When you take that ring off, that blood's going to drain out. So you're going to go limp. I don't have any advice for keeping it firmer. That's not what it's for. You have to use the band, and the band keeps you erect. As soon as you pull as soon as you pull the ring off, you're going to lose your erection. And that I can't make that happen any slower or any quicker.
Alrighty. Seeing a question here about the ring maybe not being the right size from looseness. So I guess they're losing that erection with the ring on. Is this a possible venous leakage situation?
Yeah, you probably need a tighter ring. Because yes, if the erection is going away, then that's venous leak. Yes, that's what that is, because the blood has come in. And then if it's leaving, it's most likely venous leak, and you need a tighter band. This is your vein. This is your vein constrictor. And if you have a nice firm erection when the blood is pulled in, but it doesn't stay, you need a tighter band to keep it in.
This person is asking how to get a better vacuum seal with the VED. It's a two-parter, and they're wondering if they need to do some shaving to get a better seal.
Yeah, definitely. If you're having a hard time with a seal, you probably do need to shave. Yeah, I definitely hear that.
All right. Let's see. This person says they have 3 different pumps with a variety of different sized rings, but none of them will maintain an erection. May I have something else going on here other than ED?
That's someone I'd really want to evaluate in the office. That's a hard webinar question.
Yeah.
Because you've used 3 different ones. If you had one, I'd think, okay, maybe something's wrong with the pump. Maybe you're not doing it 100% correctly. But if you've tried 3, if you've tried all sorts of different devices, I'm thinking maybe there's not enough blood flow available to get the erection in the first place. Okay, I'm thinking this is probably someone that should think about the implant surgery. If you failed multiple vacuum devices, I don't think you need to go buy a fourth one. You need to make sure you're doing it right, but it sounds like you probably are. And if the problem is there's just no blood to pull in, then you would be needed to talk about an implant surgery.
Alrighty. Let's see, moving right along on our list of questions here. So this next question here, this person is asking, when I use my vacuum erection device, only the head becomes engorged, looking like a mushroom. Please help.
That happened on my model. My model did that too. And it was really funny looking. It's one of the reasons why I didn't want to bring the model onto the video. I didn't want to terrify you if you haven't tried a vacuum yet. I think you don't have a good enough seal. That's what I think the problem was, because then when I readjusted the pump and got the whole base of the penis, I wound up using the smaller one of these. I think it was too wide. It just wasn't creating the best seal. And I also pushed harder against the fake pubic bone. So I pushed harder to create a better seal, and I used a more narrow ring at the base. And then when I had that, the whole penis felt the suction. It's like there's not enough, there's something's wrong with the seal, and only the head of your penis is benefiting from the suction. So try again.
Ready, great advice there. So next question we have is about a VED device that may have not come with the ring loader, if you would, the cone that she showed you in the demonstration, or maybe you lost your ring loader. So how do I get this band onto the base of my penis without this?
I'd probably call and ask to buy one, but this one's been played with a lot in my office. You can, I mean, I'm working pretty hard. You can stretch it by yourself and maybe slide it on, but I'm pulling pretty hard to do this. So you could try that, but I think I'd probably just call the company and ask for a replacement. I don't know, you can't go to Amazon and buy one of these. I don't know how to invent one in my garage. I think I would just ask for another one. Or you can try to stretch these out enough, but I worry that if you try stretching it too much, it won't create a good seal anymore. So I would try to buy another one.
I would suggest that as well. All right, so moving along to our VED, prostate, and penile rehab question section here. First question, any clinical observations for men who wait 10+ years following a prostatectomy to start VED therapy for rehab? I guess they're maybe wondering, does it still work?
Our data isn't there for it. We don't have studies where you started 10 years later. I think if you're going to do the rehab, you do it right away, right? If you're doing the rehab to try to immediately get the muscle memory back, the length back, the blood flow in and out, reminding the penis what it's supposed to be doing, I think you have to start soon. The other benefit to that is it takes nerves. The classic teaching is it takes nerves a year to heal. We now have data that nerves can still heal for 2 years. And so you think the prostate surgery, whether it's nerve spare or not, the nerves to the penis get damaged. They have to. They could either get cut to come out because for the control of cancer, they're in the way, or they get damaged by getting pushed aside to spare them, but they still have to get pushed aside, and it's pretty rough on them. And so 1 to 2 years, my guys that are just trying to avoid everything and they just want to see what can they do on their own, I tell them by 2 years, this is about as good as it's going to get. And encouraging that healing process, encouraging that blood flow right away is so important, and we've studied it that way. 10 years later, if they come in, I'm happy to start the algorithm of daily Cialis, vacuum, injections if you want them. But I'm really talking to them about the surgery to do the implant, because 10 years later, if you haven't been using it, you've got muscle fibrosis, okay? You've got all these other permanent tissue changes that have developed over time. So you wouldn't expect the same results, but you can try it.
All righty. That is some great insight there. I guess we have someone who has seen some success after 10 years in the chat, so he's reporting himself, so that is great news.
That's really good, and I like to hear that. Just because we haven't studied it doesn't mean it's not true. We always learn from our patients.
Yeah, there's I guess the point there is, it may not be in the literature, but there's still hope. Yep. Alrighty. So on the reconditioning topic here, is reconditioning something that needs to be done indefinitely?
Yeah, I mean, it's like the phrase is stupid, use it or lose it, but if you go to the gym and you have a six-pack, do you stop going to the gym and expect the six-pack to stay there? No. I mean, if you're 18, you're lucky, right? But no, you have to keep doing it. If you're doing it for length, after prostatectomy, there will be a point that it stops getting any longer, okay? And then you don't have to do it anymore because you've gotten it back. So there's that. I usually have my guys, usually for about 3 months is what they're doing, until they say, okay, well then this is where I got and this is where it stayed and I'm happy here. But it's certainly not, you're not going to hurt yourself if you keep doing it. But it is, I do think if you're using it for reconditioning, yeah, unless you get to a point with reconditioning that you have natural erections again, then maybe you don't need it, as long as you keep having the natural erections and keep reminding those muscles how they're supposed to work.
Alrighty, perfect. I think that just actually answered a question that trickled in about could penile reconditioning with a VED create a situation where over time you would no longer need this VED for an erection when you could have a natural erection? So
that's the goal. That's the goal of reconditioning.
So yeah, that is sounds like it's very possible. Alrighty, on the same topic here, we've got a handful of these that are falling in. So this person says, I've had a radical prostatectomy 2 years post. When I reach climax, I release urine, sometimes little, sometimes too much. Is this normal?
Yeah, it has a medical phrase. It's called climacturia. It is, so orgasm and ejaculation, it's a relaxation of the pelvic floor muscles. So as they relax, all that kegling, all that tightness you've learned to keep the urine in, some of it relaxes and some of that urine can fall out. So yes, that is normal. There are things that can be done to help that surgically. If it doesn't bother you, don't worry about it. But yeah, that is a real thing that happens after prostatectomy.
Alrighty. Next question here. I've been using a VED daily for rehab since my prostatectomy 19 months ago. I've not yet resumed morning erections. Should I have expected to have these morning erections back by now?
Well, we just had that nerve chat. You're almost at 2 years. I'm going to tell you, my guys after prostatectomy that I see that get return of morning erections, it's got to be 10% or less, regardless of whether they do the vacuum device or not. It's the nature of the surgery you had done. Most of my guys are going to need some help, whether it's a daily Cialis, an as-needed Viagra, or the vacuum for erections, not just for rehab, but for the erection. It's going to be pretty rare that they just come back and you're back to normal. So hopefully you've talked to your urologist about that, but it happens, but it's not really expected because it'd be rare for that to come back.
Alrighty, let's see. We're just going to be jumping around topic-wise for the last few minutes here. So this is more so on choosing the right VED. This person is asking, do VED devices come in different diameters?
Yes, that's the bottom part. Well, the tube, not the tube. Actually, Ashton, I don't know if you guys have, these are the same diameter, but this that goes on the bottom of it that you introduce your penis to the tube through, these are different diameters, and this is where you make the seal. But these are the same.
Yeah, I think those are the two sizes that MenMD offers. There may be different sizes out there if you find that not fit. But yeah, for the most part, the ring at the base, I think, is what
right, because it doesn't matter. Your penis doesn't have to fill in width against the glass cylinder. It doesn't have to do that.
Yeah. Alrighty, let's see. Next question here. Will a VED work after a coronary artery bypass? After this procedure, I cannot get an erection. I'm wondering if this will help.
It should. It should. What the bypass is showing is that I draw a picture. I can draw a picture real quick. I like to draw a picture for my guys that have a lot of history of heart disease or heart issues because it just makes it easier to understand. Let's say that this is, the biggest one is the artery to your leg. The middle one's the artery to your heart. The small one's the artery to your penis. I'm sorry, your penis arteries are small. And then I'm going to put plaque, the same size plaque in each circle, okay? Look at that plaque in your femoral artery. You don't feel anything in your legs, right? Look at that same plaque in your heart artery. It's halfway occluded. You need a stent, right? And then you put that same plaque in your penile artery, there's no blood flow, okay? And there's small vessels, there's other things, right? You don't lose it all, but that's when erectile dysfunction starts. because the blood flow is compromised because you've got plaque buildup everywhere. So if you've had coronary artery disease, you've had stents, you've had a bypass surgery, that is a sign that you probably had erectile dysfunction before that, probably for several years, because you were building stuff up throughout your body. But the vacuum is really good in this situation because you still have blood supply to your penis. It's just the main artery has been compromised. The flow is not what it used to be, but the vacuum is going to encourage other blood vessels to open up and to bring blood in.
Jumping around on the question matter, this next question rather is, can you use both Cialis and Viagra together? The pharmacist says no. Why?
I hate when the pharmacist tells the doctor what to do. This drives me crazy. Like insurance companies. Yeah, I got a lot of guys. I put them on daily Cialis. It's 5 milligrams. It's a low dose, and that is the loading dose. It keeps the blood flow open. And then when they want an erection with their partner on date night, then they take a Viagra on top of it, or a stronger dose of Cialis. So yes, it is okay. What are you going to do? You might get a headache. If you get a headache, then hey, you got to take a lower Viagra, right? You have to, you're not going to hurt yourself. I mean, I say that everyone can have trouble, you can have a serious event, but the reality is that I've got, most of my guys are doing that. And I hate when the pharmacist balks at that because they can't make the rules. Some of my guys, I'll print them out of paper. They'll go to 2 different pharmacies, a grocery store and a Walgreens, and they'll just fill it in 2 different places. If the pharmacist really gets mad at them, or me personally, I will write in bold in all caps in a note to the pharmacist on the prescription, okay to have both per MD order. And then I don't get any trouble.
That works out. We just got a follow up on that as well. So this person is asking to confirm you can do both, and I think the answer is yes. But what dosages?
You got to talk to your urologist because they're the ones prescribing it. I do a daily 5 milligram Cialis or tadalafil. I got almost all my guys on that. And then I will do an as needed 100 milligram Viagra on top of that if they respond to Viagra. A lot of these guys do the 5 milligram Cialis and an as needed 20 milligram Cialis. And then that's the trick, because you could just take 4 of your 5 milligram doses and you don't have to go through the pharmacist at all because you already have them. You just take 4 of them and then you skip your daily Cialis the next day. And so it starts reaccumulating. And a lot of these guys use GoodRx or pay cash for the Cialis anyway, so you can refill it sooner than 30 days because you're not under any insurance rules. So that if the pharmacist is really being nasty, I just say, well, take 4 of what you already have, skip the next day's dose because you have enough in your bloodstream, you don't need it, and do that once or twice a week, and then you're fine. It all evens out at the end of the month.
Alrighty. Let's see. This question here, different topic. Can one use a VED with a varicocele vein? If I said that right.
Yeah, it shouldn't affect it because the varicoceles are in your scrotum. So it shouldn't affect it. It shouldn't have any pressure or pulling on them at all.
This person says they suffer from really bad headaches when using Cialis and the other PDE5s, although they all seem to enhance his effect of the VED. Are there any suggestions to combat this?
No, it's such a bummer. It's such a bummer. It's hard because you could try the different ones. Some guys have less headache with Cialis than they do with Viagra. You could try Levitra. You could try the other ones. It sounds like you've tried them all. There are some guys who take Tylenol with the Cialis to prevent the headache. You can try that, Tylenol or Advil, but then you're taking more medicine to prevent a side effect. It's probably just not worth it. You might want to look into injections if you're up for it. Not everyone's up for trying injections. And you can go down the surgery road and talk about an implant, but we don't have anything else in that medicine category.
Alrighty, we're going to have time for 1 or 2 more questions here. So next question, this person says they have a slightly tight foreskin, which limits how much they can pump. They say, I have been pulling back my foreskin at night to go to sleep and leaving it all night, and they're wondering if this is a good idea or should purchase a ring for this.
Oh, no, you should ask your primary or your urologist for a steroid cream. Because if you're having issues with your foreskin, if it's too tight, you can put a steroid cream on it to soften that skin. Because if you leave it I don't like what you're doing at night, because if the foreskin gets trapped and you can't reduce it in the morning, it can create like a constriction band on the head of your penis that's like a surgical emergency. You have to be really careful with that. If you're having trouble stretching it, get a steroid cream. It'll thin the skin and you'll be able to stretch it out better. And then you won't have any trouble because it'll be easy to move back and forth.
Last question for tonight, and if unfortunately we didn't get to your question, we will give you some follow-up options in a second. So I'm on 5 milligrams of Cialis. What is the difference between 20 milligrams Cialis before intercourse and 100 milligrams Viagra?
No, they're the same thing. It's just a different pill.
Alrighty.
Different pill, different dose, but it's the same concept.
If you'd like to learn more about VEDs, or if your question unfortunately was not answered tonight, you do have a few options. There will be resources on the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. If you still have a question and would like to speak to someone in person, you can call MenMD at 857-233-5837 to schedule an appointment with a personal health assistant. If you're interested in purchasing a VED that we discussed tonight or learning about how much they cost from MenMD, you can do so by visiting the shop page on menmd.com or again by calling our office at 857-233-5837.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.